Hi, my name's Scott. I'm one of the veterinary nurses here at Absecon Veterinary Hospital. Today I'm going to go through how to give your pet sub-Q fluids at home. It's a common question that we get on how to perform this. Patients that need sub-Q fluid administration at home for diseases such as kidney disease can be a little bit nerve-wracking at home for you, so I'm going to go through it step by step for you on how to do it. First thing is to go through the supplies that you'll need, and you'll need to have a bag of fluids, you'll need to have an IV fluid line, and you'll also need to have a needle. I'll show you how to put this together at home if you need to be able to do that. So first thing you want to do is you open your bag of fluids. You'll see here that it's numbered from 1 to 9. This is, each one of these bags is a liter bag. Each one of those numbers is 100 milliliters of fluid. So depending on how much fluid you need to give to your pet, that'll be your guide of how much you're administering. This is an IV fluid line. This is what we're going to insert into the IV fluid bag. You'll see on this, this is what goes into the bag. It's a reservoir for fluids, as well as there's a clamp here that you can use to stop the flow, as well as a dial. You can use either one or both. So if you're going to administer your fluids, first thing you do is to pierce the line. You'll take the bottom out of it, the stopper, and then use the piercing point into the hole. If you turn it upside down, it'll start to flow. You can see you want it to flow to the end of the bag, and then you'll turn it off with either the clamp or the dial. Turn it off, you just dial it all the way down. After that, you want to take your needle. So this is an 18 gauge needle. Try to use a large bore needle because it allows the fluids to get administered faster. Each of these is sterile when you open them. So you'll see that it has the needle end. If you look at the end of your fluid line, there's a cap. Just take the cap off. It's a screw, and then you want to screw your needle onto there. To take the cap off, you'll notice that it's a beveled needle. It's very sharp, so be careful. You want the bevel side down so that when you're inserting it into your pet, that you have that sharp side up. So then just be careful when you put the needle back on. For the bag, you want to have the bag. You do two things with this. If you're by yourself, you can hang it from a hanger on a door. Gravity is your friend in this situation. Or you can actually do a light squeeze on your own to be able to administer the fluids at a decent rate. So at this point, your setup is all ready to go if you'll be able to administer fluids to your pet. We're going to get our subject here. It's our hospital cat Fred. And then we'll be back to be able to show you how to administer the fluids. So this is Fred. He's one of our hospital cats. He's gonna be here for our demonstration. So when we administer sub-Q fluids to a dog or a cat, they have a lot of space underneath their skin where we can do things like administer fluids or medications. When we administer fluids under the skin, it allows them to be able to absorb that over a period of time of 12 to 24 hours. So usually we do it in this area here behind their head. They're doing multiple doses of sub-Q fluids over days. Just want to vary your spot, not do it in the exact same spot every time. As I showed you before, so with our needle, we're going to take the cap off. We have the bevel down. When you look at Fred's back, you can see he's got a lot of space here. So what I want to do is get some skin up in one hand. You'll see there's a little tenting spot right here. So that's where you're going to put your needle in. You want to just kind of feel with your finger just like I am. You take your needle with the bevel side down. You're going to insert that at about a 45-degree angle. So just like this. And then make sure that Fred is nice and comfortable. Depending on how many fluids you need to administer, you might need a helper, but for Fred's pretty good. Most of the times your own pet could be very good for this as well. So we give fluids, said we're gonna do an amount. So I'm gonna give Fred 100 milliliters of fluids here. So from the time that Fred wanted to get away. So from the time the bag is new, there's a liter in there. So 100 mils will be to the 100 line. And each subsequent time down to the 2 would be another 100. So, and there's a half line in between that would be 150, 250, and so on. So depending on how many fluids you need to give, recommended by your veterinarian, that would be where you're going to go. So this time I have both the clamp and the dial on here to turn these fluids off. So I'm going to open these up. So open the clamp first, and then I can dial the dial up to open the line. And you'll see the fluids are running right here. So now we've completed the administration of fluids. Fred's gotten 100 milliliters. So now I'm ready to take the needle out. I'm going to I'm going to clamp the fluids off again, turn the dial down so that our fluids are stopped. And when I'm ready, I can put the bag down at this point. I'm going to take the needle out of Fred's back and then just want to hold it on for a second. Sometimes these can leak, so you may want to have a gauze or a paper towel nearby to hold on to it so that while the hole closes, and you may notice a little bit of fluid on his back. That's perfectly normal. Sometimes other things that you may notice here as well, you may notice a little spot of blood in case you happen to have hit a little blood vessel in his back. Those things are normal. It's not something we like to see every time, but if you do see some blood tinged fluid leaking out, that's what that is. It's just a little spot that we may have gotten. You may notice, depending on how much fluid you've given him or your pet, that you'll notice a bubble in that area. That may move throughout the day from gravity, so you may notice it on their side. Nothing to be concerned about there. And like I said before, it takes about 12 to 24 hours for your pet to absorb the fluids. If you have any questions, it's something that they can certainly get used to, and if you have to do it chronically at home, we can show you and do a demonstration here in the hospital as well if you need any additional information.